Hey guys, we are talking about medical history forms because if we're getting into lymphatic drainage massage, facials, manicure, pedicure, waxing, it doesn't matter. They should be filling this form out. As therapists, we want to be as professional as possible, but we also want to protect our clients and ourselves because we don't want to get a lawsuit. You're paying for insurance, but you really don't want to ever have to use it. But we really want to ensure to our clients that this form is to make sure that we are doing a treatment that's 100% safe for them and that we understand what's going on so we can enhance the service and maybe help them get over whatever is going on in their body if we can. But I am going to talk a little bit about this form because it is a great form. If you don't already fill this out as your business owner, there's a lot of information on the top where you're getting their information, their name, first name, last name, phone number, email. They may choose not to give you contact information. That is completely up to them. But it also asks birthdays, allergies, would they like to receive newsletters? Like, these are really important for ongoing marketing. So you definitely want to incorporate this into your medical history form because it is a great tool for future business. But for dealing with people who are coming in for a service, you absolutely have to fill this out. And some of the questions we ask on here, one of the categories is respiratory. So do they have problems breathing? And is it because of are they sick and we don't want to treat them if they're sick? Or is it a pre-existing condition like asthma or emphysema that they are under doctor's care for? And then if it's severe enough, do they have a doctor's note? Because for certain like emphysema, I would absolutely want to make sure that the doctor said it's okay for me to work on them before I just go ahead and be boldly feel confident enough to work on them, because I don't know enough about their condition from them talking to me. I would prefer the doctor's note. And then you go into the circulatory system, high or low blood pressure. So high blood pressure, we want to make sure it's managed. We never want to be doing any form of massage, lymphatic or otherwise, if they have just been diagnosed and going under testing and trying to figure out what medication. We want them to come back once they're a little bit more controlled and they've seen their doctor. If they are up and down, get a doctor's note and make sure that it is safe for you to do that treatment on them. Low blood pressure, it's not usually a problem to massage somebody with low blood pressure, but we do need to be very clear on when they sit up, they're going to get dizzy, maybe see black spots, they're not going to feel great. So maybe sit the bed up. If you have a hydraulic bed, sit it up and get them a glass of water and kind of let them come back to their equilibrium properly when they're and not feel dizzy or faint or want to pass out. Have they had a heart attack in the past? What does that look like? Do they have physical challenges left over from the heart attack? How long ago was it? Are they on medication? What type of medication? And is it controlled? Very important to ask these questions, as we will be. If you use the same form for just massage, you could be going into massage where you are affecting the circulatory system. Strokes, pacemakers, all that stuff. We want to know a little bit more information, again, depending on where they are and any kind of residual challenges their body has. If the doctor has said, yes, please go ahead, this is perfect, and they have a doctor's note, then you're fine and you've covered yourself and you know that you are not doing a treatment that's going to hurt your client. But also skin conditions. Do they have anything that could be communicable that you don't want to get? So you need to understand more about what's happening on their skin. But then also questions like loss of sensation. Like, do they have diabetes? Do they have neuropathy anywhere? Because we also want to be careful if you ever go, again, going off topic from lymphatic drainage, but if you go into hot stone massage, diabetes is a contraindication for that because they don't have the feeling and you could end up burning them and they may not know until a little bit later. The epilepsy, cancer, like what's going on inside their body. So these forms are really important. Head, neck, do they have vision problems? Do they have neck problems? Are the neck problems from not sleeping well? Are they from a virus that they got that is affecting a part of their neck? So ask questions. If they say that they have neck problems, say, can you tell me more about what's going on in your neck? Just so you understand, oh, I slept wrong, I was in a car accident 10 years ago, it never got better. So just really understanding your client as best as you can. Do they have more serious diseases? Hepatitis, TB, HIV, understanding a little bit more. You can work on someone with HIV. They are fine. It takes a lot to attract. You can even do a pedicure on someone with HIV if you want to wear gloves. That's your choice. But it's not an easy one to contract just by doing a massage. You really need it to be blood to blood or fluid to fluid. So, and it doesn't live more than a few seconds outside the body. You should be more scared about hepatitis because it lasts a little bit longer outside the body and can be detrimental to our livers. And then if they're pregnant, just what trimester are they in? Are they first? It's a little, I would always get a doctor's note if they're in the first trimester, because that whole trimester is a little bit of a delicate place for the woman to be in. And then there's also a section on what's going on, like where is your soft tissue damage? Like, do you have sore neck, sore shoulders, and understanding a little bit more about their body and why it is that way. Oh, my upper back's killing me. Why is your upper back killing you? Oh, because I have a very aggressive job where I have to do a lot and I'm constantly working. Some people will be at a computer all day with a mouse and literally their shoulder freezes because they're sitting in this position. I can't even see, but you're with your mouse in that position, you don't move. I had a question asked to me by somebody in the industry that said, you know, I fill out a medical history form, and what happens when the client lies on the form or chooses to hold back on the form? It's really important that you have these forms because we want to make sure we understand their medical information and what's going on with them. But knowing that we can't control what our client chooses to share with us or not share with us, these forms are also here to protect us. If they choose not to share with us, then what we don't know, and we can't move forward. So these forms also protect us, where if they had something wrong, we can go back to the form and see that they never told us on the form. So understand that these forms are really important for your protection as well, and to make sure. But there are times when you can ask extra questions, like, do you have any allergies, especially to nuts or to shellfish, or getting more information, because as we all know, in the industry, certain reps they can't do if they have a shellfish allergy, or if they have a thyroid condition. You know, different algae reps are not usually going to be the best choice for them. Not that you can't do it, you just have to alter it and choose a different type of wrap as opposed to the algae. Maybe go into a chocolate or a different mud wrap that doesn't have the algae component into it. But you have to ask questions as well. So just take the form and read it, but then definitely go into questions and ask. Usually if clients don't fill out, and I've had this a lot, where a client will take me aside and say, because they're here for a group and it's a party of them and it's a bridal party, and they'll say, I'm pregnant, but nobody knows that I'm not. I don't want to tell them until I'm 3 months. That's fine. You can take them aside. You can have them tick off on the form that they're pregnant. They can initial it so that they told you and you understand it. It's on the form, but then the form stays away from the rest of the people. So as long as you, again, open up a communication between you and your client and make sure your client feels safe around you, feels comfortable around you, and you ask a few more questions. You don't just look at the form and say, okay, great, let's go. Definitely ask questions. Get to know your client, because the more you get to know your client, the more they're going to feel safe, better the relationship you're going to have, and the better chance they're going to book back with you. Talking a little bit about the lymphatic system here and helping you understand a little bit more about it as you're reading through the articles and stuff. Most commonly in your neck, if you have a sore throat or a cold, you'll feel that the lymph nodes will swell. This is where the white blood cells are now coming, and you have lymphocytes, and you have all these beautiful things that the lymphatic system is doing to fight that infection. So it swells in order to fight what's going on in that area. It sends little armies of white blood cells to the area to help to fight it. If we're sluggish, or we stay in bed too long, or we're not mobile, don't like to work out, couch potatoes, people who may have had an accident where they've injured themselves and physically can't work out, which then they're finding illnesses are setting in, infections are setting in, wounds are setting in. This is all very common to happen to people that physically can't really do a lot of exercise. So if you can't exercise, or you know somebody who can't exercise, then lymphatic drainage massage is a great alternative to help move that lymphatic fluid so that we can give them the optimal health. There are very much, there are contraindications to this. So you have to be careful and understand more about what's going on. If they are showing signs of an infection or disease, stay away from them for now. Let their body do what it has to do. And then once they're a bit healthier, because what will happen when you do a lymphatic drainage massage, if somebody has a cold or flu coming on, they will get over it faster, but you're going to make them even more sick. So it can be a lot for a person to go through if they're feeling not well, and then you do lymphatic drainage and they're even worse. And then they get the idea that you made them sick. Well, it's not that you made them sick, it's that you've increased the lymphatic system, which is helping to fight that infection, which is going to make them worse before they're better. So it is sort of like a little bit of a trickle effect. But if somebody is sick, wait until they're a little bit better. Also, you can get, as mentioned before, you can get sick or not feel well after a lymphatic drainage massage, but we didn't make you sick. And just letting them know is sometimes we have bacteria or viruses in our system that we don't know yet because we haven't shown the symptoms, we haven't shown the sore throat, but it's kind of existing in there and it's getting ready to show itself. We're just going to bring it on a little bit faster. We can't sit there unless you're coughing and sneezing and you are sick yourself working on your client. You're not going to make them sick, but you can bring out something a little bit quicker. So it's important to really educate your client on what they are feeling and also let them know what's going to happen. And again, remember, and I will say this every single time, they need to drink lots and lots and lots of water because this is going to help them to be able to release the toxins and get better faster. Like anything we do in our industry, water is our best friend. Stay tuned for some more videos. Some other contraindications that I wanted to talk about, and as an oncology esthetician myself, I do a lot of treatments on people that are, you know, going through either chemotherapy or are past that and are just looking to feel better from the repercussions of all the treatments, because it does leave a devastating results back in their body as far as neuropathy, and sometimes they develop arthritis. They can develop a lot of aches and pains that won't go away, almost like a fibromyalgia that they just, and it's all results of the chemo and radiation and just the toxins that are left in their body. Once they're post-care, you can do lymphatic drainage on them to help them with that. That is a possibility. But know that if you're working on somebody who has had breast cancer and has had a double mastectomy or even a single mastectomy or a lumpectomy where it may have affected lymph nodes, or if they've had the mastectomy and had the lymph nodes removed and they have edema in their arms, you do not massage that. You do not do lymphatic drainage on that. You do have to send them to a lymphedemist, a specialist, a doctor who specializes in lymphatic drainage techniques. You don't want to touch that because you don't know which lymph nodes have been taken out. You aren't sure of the treatment that they've had while under surgery. So we really want to stay away from that. Even as an oncology esthetician, we want to be very careful on how we help our clients, because we do want to help our clients. And we need to be really careful on what we do and asking the right questions. So even though they may have swelling in their arms, if it is from surgery, you want to definitely refer them to a specialist and not touch them. Now, going back, I have worked on people who've had higher blood pressure but under control and on water pills where their legs swell. Again, ask the questions, because you can move that fluid out of the legs very successfully and make them a lot more comfortable. And I've done it many, many, many times. But I will tell you a story where I saw a gentleman here, and he was a little out of breath. He's a bigger man, so, you know, normally you wouldn't say anything because he was definitely had a weight problem. But because I've seen him quite a bit and I do pedicures on him regularly because he's also diabetic, and he was really struggling to get onto the pedicure chair, and I saw his ankles and they're pretty swollen. I'm like, oh, I could do lymphatic drainage on that. But I said, you're really struggling to breathe. Are you okay? And he said, I'm just really tired. And I said, okay. And I looked at his toenails, and they weren't quite the color I wanted to see. They weren't blue, but they weren't pink. and I had alarm bells going off. So I said, you know what, I'm not going to touch you at this point. I'm going to ask that you go see a doctor. His daughter was with him, so she took him to the hospital because, again, this is during COVID, so she had to wait outside in the parking lot. And he went in to see a doctor, and he was in heart failure. And if he had gone home that night, he would have passed away. It was that bad. They kept him in the hospital. So always ask questions, guys. It's so important to understand where that swelling's come from and why it's coming. We can help some people, absolutely. If they up their water pills, or they have they were sitting a lot the day before and their legs swelled, then absolutely we can do lymphatic drainage, as long as they don't have any of the pre-existing conditions like active heart conditions that maybe they're not on the medication for. That's really going to help them get it under control. Obviously, you're going to fill out a medical history form. I'm sure all of you are doing that. It's an absolute must in our industry to fill out the medical history form so we can get more information, but sometimes they don't fill out everything. So definitely do your research and ask them questions. Make sure that you are doing them a positive and not a negative. We don't want to hurt them. We want to help them. We want to heal them. We want to have them be their beautiful souls that they are. So we have to be very mindful, and as therapists realize that there are limits that we do have, and we have to respect those limits. Stay tuned for more videos. Now, though we're not actually going into the circulatory system and massage in this course, it is a huge part of the body. It's like the most important part of the body. If we didn't have a circulatory system, we would be in trouble. So, and our heart having the pump and everything, it's really important that you understand when we do massage people. And I like to just put this out here, even though we're not teaching this course, I do a lot of massage. And it's amazing when you get to the end, or you're about halfway through the massage. 100% of the time when I massage people, their stomach will start to go. They'll start, not only will they relax, but they start to feel like a tingly, like almost like the nerve endings are waking up, which they are. But the stomach gurgling just shows you how powerful massage in general is, because it works on their digestive system, it works on their circulatory system, it works on their sympathetic nervous system. Like, massage is a beautiful thing. So definitely always incorporating massage into your business is a wonderful, amazing add-on. It's also less expensive than facials because you're using oil and sheets. You're not using all of the products in facials. So it is a nice add-on for lymphatic drainage or regular massage. But I wanted to touch base about the circulatory system because it is as equally important to do regular massages on top of the lymphatic drainage massages, because then we're promoting a really healthy body all around, as opposed to just getting the lymphatic system. They both have amazing qualities to them, but being able to fit them in, where maybe you do a lymphatic drainage massage and then do 3 months of regular massage and lymphatic drainage massage, you can get them onto a little program that helps to give them the best opportunity to feel amazing all around. So looking a little bit more into massage and the body and what we can do to help, we talked about the lymphatic system, about swelling and stuff, but we can also help move things like poor circulation in the body, especially if they're diabetic and they're really feeling the numbness in the legs. We can really help to move that blood and deoxygenate it to give them healthier outcomes for their limbs, as long as it's not out of control diabetes. And then again, if you start to see a bluish tone to the legs or feet, we should not touch them and have them see their doctor, just to make sure that we're not injuring them any further. But definitely looking into creating a massage overall program for your clients is an incredible health and wellness benefit to your business. And you will find that your clients will thank you, because they will feel great all around. And all we want to do as estheticians is show our clients results. See you in the next video. Some product knowledge for massage. There's not a lot to know. When you're doing facials and stuff, you're gonna do your product knowledge training through your supplier. But with massage, I find it's really important to get an oil that is completely scent-free. I would invest in essential oils and use something a little bit more natural. So if someone did want a scent, or someone's really stressed out or anxious, you can add a lavender in there, or you can add a sweet orange or basil or whatever you're doing to help that client for that moment. But getting a scent-free oil really makes everybody happy, because there's a lot of people these days who really don't like any kind of scent on their body, and they find they get headaches or it triggers migraines. So being respectful of your clients and bringing in a scent-free, I use jojoba oil. And it's a mixture of jojoba oil, vitamin E, and a little bit of aloe in it. And I massage with that. It's a beautiful oil. But there are, like, you have sweet almond oil. You have to be careful with allergies. Again, if people have almond allergies, it's usually an ingestible allergy. However, if it is not, and they're more severe and they just have to come in contact with it, you just want to be mindful and have another oil. There's grapeseed oil, there's coconut oil. There's so many oils out there. I mean, the list goes on and on and on. I will tell you, for grapeseed oil, I have used it in the past. It is a nice oil. It has a great slip. If you're using white sheets, it does stain your sheets and doesn't come out as easily. So I tend to stay away from that and stay more to the clear oils. The one I use is clear. Coconut oil is clear. So like jojoba oil is very clear. So taking oils that are scent-free, that are great for your clients. Be careful not to grab the oils that are $9.99 for a 4-liter jug that's mineral oil, because it's not great. It's not healthy for your client. We're doing such great treatments, and we're really caring about their health and wellness. We really want to care about what we're putting onto their skin. So the higher end oils, like the coconut oils, the jojoba oils, the grapeseed oils, the sweet almond oils, is giving them the treatment that they want with the health benefits of a healthy oil that we're going to be using on them. So be mindful of that. There's another product I use, and I do use it in my massage, and it's called Japanese mint oil, and I am in love with this product. It is a therapeutic oil. It is very difficult to find, but you can look up Japanese mint oil, and right now the only distributor I can find in Canada is in Winnipeg, where I order it from. But this oil is from the Japanese mint plant. It's pure, it's an essential oil, but it goes in deeper. So I say to people, it's like 8535 on steroids. This thing goes in and just penetrates and heats up. And my clients have had, especially after the treatment and after massage, whether it's, I do a lymphatic drainage and then they have a little bit of pain, so I'll go back at the end and add the oil. So before they leave, they just say it's amazing how it relieves the pain for a few hours. And it's pretty incredible when somebody who's in a lot of pain all the time, getting a 3-hour break from that pain is a beautiful gift. And then they can take it home and they can use it at home. It's a great retail opportunity. As well as essential oils are in your treatment, are a great retail opportunity because they can take it home. And essential oils can be burnt in the air, they can be put on the body, they can be put in the bath. It really depends on where you feel they'll benefit the best from it. And doing up a little sheet, you can do up a little tiny sheet on what oils are for what conditions, whether it's skin conditions, whether it's internal conditions. You can do up a little cheat sheet, and then they can have it right beside the oil so they can kind of look at it and definitely see what oil are best for them and what works best for them. So checking out different products, you have to do your research. You have to find the supplier that's great for you. If you're specifically looking for massage, Know Your Body Best is a great one in Canada. But if you're looking at other suppliers, just do your homework and make sure you're getting a higher quality oil, because you're doing a high quality treatment. So we don't want to do a high quality treatment with cheap products, because it will show up. Like, eventually your client's not going to get the results they want. They could get a reaction or an irritation to the oil, have to go on to medication to help take down the swelling. We want to be mindful and use very pure natural products on our clients so that we give them the best results for that treatment. Welcome to your lymphatic drainage massage. We're going to be talking a little bit about the whole part of the body and how we're going to do lymph drainage. Now, we don't need oil to do lymphatic drainage. However, you're more than welcome to use oil if you want. When you're spreading oil, you would do an effleurage motion to spread the oil, but you notice if I'm pushing like this and spreading, I'm actually hitting the circulatory system. This is how we normally do massage, but for lymphatic system, we really want to deal with the ultimate health of the body, moving fluid, making sure disease, infection, everything stays out of the body. It's a very different technique. So we're going to start now. When we're talking about lymphatic system, as you've already seen in this course, we have lymph nodes behind the knees and we have lymph nodes under the buttocks. So we're going to work on the top and we're going to work with lymphatic system. It doesn't have a pump, so we need to be its pump. So we're going to slightly press and act as a pump to the skin and then brush. Again, a pump to the skin and then brush. We want to make sure we cover the entire leg. And it's important, it's a very delicate massage because if we go too deep, you bypass the lymphatic system and you're on the circulatory system. So it is a very light, almost like petting massage, which sounds very wrong, but look at it that way because once you go too deep, you're hitting the circulatory system. We're not doing the lymphatic system at all. And we move down. We want to move the fluid upwards and then we want to move down. We don't want to congest any fluid. So we want to make sure the blockages are done from the upper part of the leg, and then we move down to the lower part of the leg. Now something like this, doing these motions, and you can do full sweeps up the leg. Again, very light pressure. You're moving the fluid up to where it needs to be because then the lymph nodes will take it and do what it needs to do with it. This should take 7 to 8 minutes per leg. You're going to be going much slower. And then you're going to move and do the next leg. We are going to redrape the leg and we're going to move up to the back. Actually, off. Lymphatic system, we have lots on our stomach, in throughout our chest and down through our abdomen into our groin. There aren't any on the back, so we need to go sideways. So we need to push it in the area we are towards the lymphatic system. So again, you can brush and you can be its pump. Now, you're going to be reminding your clients after a treatment like this, A, they have to drink lots of water. Like any massage, you want to drink lots of water because you want to purify. But after a lymphatic drainage massage, especially an hour, your client is going to pee a lot. And that's great because they're getting rid of a lot of toxins and getting a healthier body, and that's what we want. But make sure they understand that they will pee a lot. If they do start to come down with a cold or a flu afterwards and feel that possibly maybe you got them sick, the best way to explain that is with the lymphatic system, if you have a virus already in you and it's kind of brewing, for a better way, lymphatic system will bring, like a lymphatic drainage massage will kind of bring it out a little bit faster. We're just helping to move that infection through the body. So if they do get sick, it's because it was already in them. We can't make someone sick unless we're already sick and working on them, in which case you have no business working on someone. You'll notice up at the shoulder area, I'm going down and under because in your clavicle you have lymph nodes and I'm draining it towards the lymph nodes. You have lymph nodes under the arm as well. So we can drain right under into the arm. And then we repeat on the other side, again, pushing down to where the lymph nodes are and back up. And when you want to do the side, we want to push to the clavicle area. Very, very gentle massage. And again, you're looking at about 10 minutes on the back, 10 to 15 minutes on the back to really get a nice, good clearing of the lymph fluids in the body. And now we're going to turn our client over. So again, much like the leg, we have lymph nodes in the groin, but now we have lymph nodes behind the knee. So we're going to show you the lower part is a little different here, but we're going to go up and we want to push that right to the groin area. And again, I'm speeding through this to give you the idea, but you're going to have nice soft music in the room and you can go nice and slow and you're going to create the same experience. But again, you'll notice I'm not pushing and moving the tissue. I am moving lymph fluid. So you have lymphatic fluids. You have to go nice and soft because we need to go above the circulatory system to really get the maximum health for the client. And remember when we talked about in the course that the lymphatic system is only engaged by exercise or massage. So we play a pretty integral part in people's well-being when we're doing this. So now I'm doing the leg and we're pumping the fluid. And on this particular client, you can see quite a lot of fluid on the lower leg. But we need to brush this behind the knee, because that's where the lymph nodes are. So we want to push it to exactly where those lymph nodes are. They will then take it and do their magic. So you'll see that I've done a couple of different techniques. We have the pumping, as we're acting as the pump. We have the fast brushing, and then you have just the sweeping. So these are the three most common techniques you're going to be using in lymph drainage massage. Again, nice and soft. And I'm doing the full lymph now. So what I've done is I've cleared half the leg, I've cleared the other half of the leg, now I can clear the whole leg. And then again, on the front of the leg, you're still looking at about 7 minutes. And there's the leg. Very similar to our leg. Again, we have lymph nodes underneath the arm, in the arm, and on the clavicle. So we're going to start on the upper, and we're going to pump, but we're going to pump to underneath the arm, and then brush. When we do the top of the arm, we're still going to do our pumping motion, but this time we're going to take it to the clavicle. Make sure you get underneath the arm as well. And then our lower arm, same, inside. We're going to pump to the inside of the elbow. And on the outside of the arm. But now we need to push to the inside of the elbow because we need to push it to the lymph nodes. And then in lymphatic drainage massage, if you feel like doing a hand massage and doing the pressure and doing a little bit extra, that's totally fine because we're not worrying about that. We just want to worry about the extremities, especially getting that lymphatic fluid moving. You can do the abdomen. There's a lot of lymph nodes within the abdomen. We're not going to be showing abdominal lymphatic drainage today, but there is quite a few in the abdomen, and you can do it for people that are struggling with digestive issues or struggling with many different ailments that could be affecting their stomach area. If you are looking at someone who maybe is dealing with puffiness on the face and you're doing a neck massage, there is also, you can push, we always push down as you learned in school, because again, you have lymph nodes underneath and you have lymph nodes at the clavicle. So you can either push to under the face or we can push down to the clavicle. And we're gently brushing. And getting rid of any fluid that's existing, getting rid of any swelling that's existing. So it's not only great for the body and great to help with, you know, making sure disease and infection stays at bay, but it's also great with anybody that's suffering from swelling or has puffy eyes or has a puffy face or is feeling really swollen. We can really move that lymphatic system and help to move that fluid and ease the swelling in the face. So thank you for watching. I know it's very quick, but this gives you a really great idea of exactly how to do the treatment. Stay tuned because we are going to be showing you how to do lymphatic drainage on the face next.